Let's talk about weaning. It might seem a little bit weird to get stopping nursing and pumping advice from a lactation consultant. I mean, maybe it doesn't. I mean, we are the people that you should be able to come to for that. But I feel like a lot of people have this idea about lactation professionals that they're very pushy. And I guess maybe some of them are, but with my background as a doula, I understand that personal choice is everything, and support in your choices is everything. So let's talk about weaning. So we'll talk about weaning from nursing and pumping, from nursing exclusively, and from pumping exclusively. And it's all going to be a little bit different, but all the same in the sense that you want to do it really gradually. So what do I mean by gradually? I mean, don't just stop cold turkey. That is the worst thing that you can do, because you're gonna get really full and really engorged and sore and risk clogged ducts and mastitis, and no one wants that. Like, that just creates more problems. You do not want to do that. Now, I understand there are circumstances where you need to not provide your baby with breast milk because of illness that requires certain treatments, treatment for certain drugs, substance abuse. There are some reasons when you absolutely cannot give baby that milk. And still in that case, you should gradually be decreasing the amount of milk that you're making by pumping and, I guess, dumping the milk. Now, the drugs that are not safe are very limited. There aren't a whole lot of them, but that's a thing. And if you are in that situation, if it's something that is a short term of treatment, so 2 to 3 weeks of treatment, however long that seems reasonable to you, you can switch to exclusively pumping around the clock during that time, dumping that milk while your baby is supplemented with formula or donor milk during that time of your treatment. That way your milk supply stays good and they are able to then latch afterward. After that treatment is done, those drugs have cleared your body. That's always an option. And I know that's not weaning specific, but I just had to throw that in there. So if you are wanting to wean from nursing at the breast, this is more tricky because you have to contend with a little person's ideas and their opinions. And if baby is less than a year, it might be a little bit easier to switch them to a bottle of formula as opposed to a bottle of breast milk. It might be a little bit harder if they've never had bottles at all to switch to solely bottle feeding. So you want to do it really slowly. You want to start with adding taking away your least favorite or least productive nursing session and replacing that with a bottle. And this is if baby's less than a year. If baby is older than a year, you don't need to replace with a bottle. You can give a snack, a cup of water or juice, even a cup of express breast milk if you have some, or a distraction. If baby's older than a year and you're tapering down, there's not a reason why you need to fill each nursing session with food. If they're hungry, absolutely. But if it's a nursing session that is, say, just a habit after lunch or something, then there's not a reason to give more food. Just give cuddles instead, read a book, sing a song. anything to distract them. If baby's less than a year, gotta offer a bottle, because breast milk or formula has to be the main source of nutrition for the whole first year. Baby, even if baby's older than 6 months and they're eating solids, you cannot replace a nursing session or a bottle of breast milk with food. You have to replace them with formula. If you are weaning from pumping, you want to, again, choose your least productive session and cut that out first. And if it's just a couple of ounces that you're getting in that session, you can cut it out completely. Just pick a day, cut it out, give your body several days to adjust. You can rearrange the remaining pump sessions to accommodate that, to be equally spaced. So if you were pumping every 2 hours and you take one away, then you want to spread it out to be whatever, 2.5, 3 hours or whatever. Whatever that comes to. Again, don't ask me to do math. So you would just then spread those out so there's a longer period of time in between those milk removals. So the fewer sessions combined with the longer duration between milk removals are both going to help decrease that milk supply. So then after your body has gone a couple of days, you feel like you've adjusted, they're not feeling super sore or full in between sessions, then you can choose another session to cut out or decrease. Now, if all of your sessions are pretty productive, you're getting 4, 5, 6 ounces or more, I'm talking total, then you want to decrease that before just cutting it out completely. So pay attention either to how long you normally pump for that session or how many ounces you usually get. So if you're going by time, cut the time in half. How long you would normally be pumping, cut it in half for that session. If you're going by ounces, cut it down by an ounce or two. If you have a major oversupply, this is where you want to be really, really gradual. You want to just take an ounce or two off at a time, because oversupply can really quickly lead to clogged ducts and mastitis if you let that milk sit around for too much. It's kind of the same, with nursing. You're going to want to really gradually give your body a few days and give baby a few days. It's probably going to take longer when you're weaning from nursing to actually wean, because you have a little person's feelings that you're dealing with also, and their needs. And it's so much easier. Parenting is way easier when you can just latch a baby to your boob. It's true. So it's a little tricky, especially if baby's not ready. But it is doable. But you want to just do it really gradually, go really slow. So you just go from there, basically. Keep cutting that session. Like if you're pumping and you've reduced your ounces that you're removing or the amount of time that you're pumping for a session, again, give your body several days to adjust. And then decrease it again. Either cut that time in half again or take back a couple ounces. You got to pay attention when you're pumping if you're pumping for ounces. But just keep cutting it back really slowly until you feel like you have cut it down enough that you're removing very little milk at that session, and you can just drop it at that point. So once you drop it, again, rearrange your remaining sessions to be equally spaced. And give yourself several days again to adjust. Now you can tell probably at this point that it's a long process, but this is the safest way to do it. Some people feel like it's easier if you're nursing to switch fully to formula and let baby sort it out with having their bottles of formula and just pumping and weaning from the pump then. And I guess in that case, baby could be getting express breast milk. Um, so like that's another option if you're just like really done with nursing, you know, and I get that. um, so those are the basics. Again, really slow. You don't want to get clogged ducts and mastitis. It's because mastitis can go from just being a swollen, red, painful boob to being like you're very ill and have a breast infection that needs to be surgically taken care of and put a drain in. And you don't want that. So it can happen really fast. So you just make sure you want to do this really gradually. Once you're down to just a couple sessions a day, like once in the morning, once in the evening, whether this is nursing or pumping, at that point it's really up to you which one you want to get rid of. Usually in the evening you're going to be getting less milk than in the morning, so that one might be easier to get rid of. But if you're nursing before bed is like a really comforting thing, so it might make more sense for you to eliminate that morning session first, because before bed is like, that's comfort time, you know, that's snuggle time. So those are usually the most difficult ones to end when you're nursing, is the before bed and in the morning, because those are like the favorites, you know, those are cuddle times. But you can still cuddle. And that's absolutely what I would do, would be replace those times with cuddles, with rocking and singing and reading books. And if that doesn't work, if baby just really, really wants to nurse still, that's when you kind of have to step back and let someone else take over bedtime for a while and create a new routine. Because that's like, it's hard. It is hard. And sometimes when you're weaning, you have to completely avoid your normal nursing spots. Like if you have a certain chair that you always sit in to nurse, or a certain spot on the couch, you have to just completely avoid it, because that's a trigger. You know, you sit down in that spot, baby gets on your lap and starts nursing. That's just where you nurse. So that can be one of those things that you just can't sit down for a while. You have to find a new chair somewhere else to sit. And that can be really tricky. Weaning is not easy. It happens. It happens to every single nursing parent ever, every single pumping parent. We all have to wean at some point. In my experience, it's much easier to just like nurse forever and let the baby wean as they naturally wean. But that's because I am lazy when it comes to that. Like, I don't want to deal with that. So if you have questions or comments, I would love to see them if you want to leave them below. And if this was helpful for you, I'd appreciate it if you liked and subscribed, and I will see you again next time. Thanks very much. Bye.